Well, good evening, and thanks for joining us on our 6 of 6 hypertension workshops done with the Town of Windsor in partnership with the Department of Public Health through their preventative block grants. Tonight's topic is urgencies and emergencies with hypertension, and Dr. Atiq Mirza is here to do that presentation. Wanted to remind you that the presentation will be done with question and answers to follow. And then there'll be a brief time for demonstration of the use of the self-monitoring blood pressure device. Also, if there are any of you who are interested in acquiring a device at home and cannot find funding to do that with your insurance company, please contact us as we can work with you to help you secure one of those. Also wanted to remind everyone to return the evaluations and the pre-diabetes screening checklist. And for each one of those that is returned, we will provide you with a $5 First Town Downtown gift card. So I wanted to encourage you all to do that, to be a part of that grant outcome information. And with that, I'm going to turn it over to Dr. Mirza.
Thank you, Jenny. And hi, everyone. How's everyone doing?
Well, thank you.
All right. So today concludes the series of lectures for this hypertension workshop. So okay, so good evening, everyone. My name is Atiq Mirza. I'm a cardiologist. I have practiced in Enfield, Simsbury, and Hartford, and our practice name is Central Connecticut Cardiologist. I also teach residents, students, and fellows both at the University of Connecticut and Frank H. Netter School of Medicine, Quinnipiac University, Connecticut. I've been in practice for more than 20 years now. I will just stop it here, not go beyond that. So today's topic is hypertensive emergency and urgency. And before I start today's talk, I would like to thank again the Town of Windsor and Department of Public Health for providing the grant, and the Town of Windsor for organizing these talks to help the community to understand, learn, and do all the preventive measures for hypertension. So today what we will be doing, we will be talking about the understanding of hypertensive emergency and urgency, and how to recognize these entities of high blood pressure, and then discuss what causes the hypertensive crisis, which is another name for hypertensive emergencies and urgencies, and then at the last, how to prevent and respond to these crises. So I would like to revisit our slide which we had in our first lecture about categories of the blood pressure before we move to the hypertensive urgencies or emergencies. This gives us an overview of the different categories or the classification of the blood pressure. So normal blood pressure is less than 120, the top number, which we call systolic blood pressure, and less than 80, which is the bottom number or the diastolic blood pressure. When the blood pressure top number ranges between 120 to 129, we call it an elevated blood pressure. And still you may have bottom number or diastolic number less than 80 millimeter of mercury. When the blood pressure goes in the range of 130 to 139 millimeter of mercury, the top number, systolic blood pressure, we call it high blood pressure or stage 1 hypertension. And with this, the diastolic number ranges between 80 to 89 millimeter of mercury. Stage 2 categorize blood pressure, systolic blood pressure above 140 millimeter of mercury, and the diastolic above 90 or higher. And when the systolic blood pressure goes above 180 millimeter of mercury, and the diastolic goes above 120 millimeter of mercury, that is called hypertensive crisis, or in other words, hypertensive urgency or emergency. And we will discuss how to differentiate between these two and how to have more recognition, understanding, prevention, treatment, and how to respond. So hypertensive crisis, as I mentioned earlier, is a term used to describe severe elevation in the blood pressure, which may or may not be associated with end organ damage, which may or may not be associated with any symptoms. So what are those end organ damage, end organs in your body? Those are your eyes, your brain, your kidney, and your heart. So usually these are the organs which get damaged with severely elevated blood pressure, and you develop signs and symptoms according to the organ involved. So, as I mentioned earlier, hypertensive crisis, blood pressure, systolic more than 180 millimeter of mercury, diastolic more than 120 millimeter of mercury. It can be divided into hypertensive emergency and hypertensive urgency. It is very simple to define these two categories under hypertensive crisis. Emergency means there will be an evidence of end organ damage, and mostly this is, you will have some symptoms associated with it, whereas hypertensive urgency, you will not have any end organ damage with it, and most of the time people don't have any symptoms attached to this kind of elevation of blood pressure. So hypertensive urgency, blood pressure 180 over, more than 180 over 120, without the evidence of acute end organ damage, and usually no symptoms are associated with it. I hope this makes it clear. The definition: hypertensive urgency, blood pressure more than 180 over 120 millimeter of mercury, and end organ damage are not happening, and you may not have any symptoms. What is hypertensive emergency? It's the numbers remain the same, blood pressure above 180 millimeter over 120 millimeter of mercury. But this is complicated by acute end organ dysfunction. And it is also associated with various symptoms depending on the affected end organ in your body. Symptoms will be differed accordingly depending on which organ is involved. Heart will give you different symptoms than the brain. Eyes will give you different symptoms than the kidneys. So, as you can tell, hypertensive emergency is more dangerous above 180 over 120. It can also cause the dissection of aorta. Aorta is the main artery which comes from the heart. Heart is a pump, and the aorta comes from it, through which the blood is supplied to the whole body. So if the pressure is so much, there can be a tear in the wall of the aorta, and that is called dissecting aortic aneurysm. And mortality of dissecting aortic aneurysm is roughly around 10% an hour. If someone has high blood pressure into hypertensive emergency range and that person dissects the aorta, mortality is very, very high. Next is a heart attack or acute myocardial infarction. And that is another end organ damage. So people can present with heart attack, people can present with acute heart failure or pulmonary edema. Pulmonary edema is when you have so much fluid collected into your lungs because heart is not able to pump the way it should. That results also in shortness of breath. So heart attack, heart failure, pulmonary edema, severe shortness of breath, which all these things can lead to, is another sign. Heart attack can also present with the chest heaviness, chest pressure, chest pain. So, and people can also lose consciousness with heart attacks at times if their heart goes into an abnormal rhythm. We call it ventricular tachycardia or ventricular fibrillation. With these high numbers of your blood pressure, you can also have renal failure. I mean, kidneys can shut down because kidneys have very small, thin blood vessels which are not even visible to the human eye. And once there is so much high blood pressure in those small, hair-thin blood vessels, those blood vessels can easily rupture. And we call that, hemangiopathies of in different organs. So that can result in kidney failure. And then wherever the small blood vessels are, wherever in your eyes or brains or heart, skin, those all can cause destruction of the blood in that small area. And that can be symptomatic microangiopathic hemolytic anemia, which starts killing the red cells in your circulatory system. So these are the few things which can happen once you have blood pressure above 180 over 120 millimeter of mercury. And these are all very serious signs, symptoms, and these are the signs and symptoms and the conditions which cannot be treated at home, cannot be treated as an outpatient. For all these, one has to be present in the emergency room of the hospital or have inpatient treatment, because otherwise survival is very poor. So let's talk about how prevalent this condition is and how deadly this condition is. So around 1 to 2% of adults with hypertension will experience hypertensive crisis in their life. Some people will experience symptoms while others will not. And then that's how we can tell, is it a hypertensive urgency or emergency? This data is a little old, but in 2018 alone, nearly 500,000 deaths in the US had hypertension as a primary or contributing cause. So this is a huge number, 500,000 deaths only attributed to this problem. If we look at the prevalence, so this is a very busy bar diagram. The blue bars represent hypertensive emergency in male, and red is hypertensive urgency in males, whereas green is hypertensive emergency in females, and purple is hypertensive urgency in females. So if we look at this, at the younger population, you don't see much around in 18 to 13 years of age. There are only very minimal hypertensive emergencies in men. You don't see that in women, and there is no hypertensive urgency. So those are usually young men who have severe, strong genetic predisposition towards hypertension. Whereas when we reach the age between 31 and 40, we see that the most common problem is hypertensive urgency in men or males, in that they have high blood pressure, but there is no symptom associated with it. In women also, if you see, urgency is higher than the emergency in this crisis, but still men have a higher incidence of having this. Next age group, 41 to 50, in which again, somehow hypertensive urgency increases in women as compared to men, whereas emergency situation is almost similar in both the genders. In women between age of 51 and 60, again, hypertensive urgency prevalence is very high, more than 45%. Whereas in men, it doesn't, it's around less than half, or half of it is among men. Then again, the prevalence decreases in age group of 60 to 70, 70 to 80, 81 to 90. And again, the last group, the women have more hypertensive urgency situations between 81 to 90 years of age as compared to men. So this is good to know that if you look at this purple bar, this tells you this stands out throughout amongst all the age groups except 30 to 40 age group, in which the men have higher incidence or prevalence of hypertensive urgency, whereas in rest of the age groups, women's incidence, prevalence of having hypertensive urgency is significantly higher as compared to men. So we need to keep in mind that generally concept is hypertension, heart disease is usually associated with men, but that's not true. People have misconception that women have more breast disease than the heart disease. That conception is not true. Women are at a very high risk as men are. And when after menstruation are stopped in women, their risk of having heart trouble is as high as any other man. So we should be very careful about treating the hypertension, about dealing with the symptoms, and not thinking that women are less exposed to it as compared to men. So then, what are the causes which leads to hypertensive crisis? So the American Heart Association mentions that the following lifestyle and the medical fatalities may increase the factors may increase the likelihood of hypertension. And what are those? As we mentioned in our last talk, non-compliance with blood pressure medications. Those who have been prescribed to take the medicines and they are non-compliant, they forget to take, or they miss the doses, or they do not take it in an appropriate way on a daily basis, or the way it has been prescribed. That is the number one reason for having hypertensive crisis. Then is the non-compliance with the diet and exercise. All hypertensive patients need to follow a diet which we call DASH diet, D-A-S-H, and exercise on a regular basis after discussing it with their physician. People who are indulging themselves in abuse of drugs like cocaine and are involved with heavy alcohol intake or other drugs like amphetamines, they are also at a significantly high risk for developing hypertensive crisis. So those are drugs should be strictly avoided in people who have high blood pressure. Actually, those should be avoided in all of us, but especially amongst those who have high blood pressure. Tobacco, smoking, that's another reason for people to develop hypertensive crisis. People who have underlying heart disease, cardiovascular disease, they are at a higher risk of developing hypertensive crisis as compared to those who have no underlying cardiovascular disease. And similar way, diabetes and the kidney disease. Last but not the least is being overweight or being obese. If someone has high blood pressure and the person is obese, the chances of developing hypertensive crisis are way more as compared to someone who has a normal body mass index. Way I can say it, though that person who has a normal weight for his or her height. So these are the factors which leads to having higher risk of developing hypertensive crisis. And what are the symptoms when we talk about hypertensive emergency? That blood pressure is high, and then what symptoms can be associated for the hypertensive crisis to make it hypertensive emergency? And I want to remind all of you that please, if someone is having high blood pressure and he or she is experiencing any of these symptoms, please do not take it lightly. Call the 911 and take the person to the nearest emergency room so that the blood pressure can be lowered and patient's life can be saved. With high blood pressure, people can have severe headache, or at times people call them migraines, but that is because blood pressure goes so high that they can feel it in their brains, and it gives them the pain or the headache. People can feel dizzy. People can feel weak, confusion, not able to sort out the things, with the high blood pressure, not understand things, not interpret things, not express properly, having numbness, tingling sensation, and severe anxiety. This has been seen more in women, but it is common in both men and women. The high blood pressure, and at times people don't even know what their blood pressure is, and they feel any of these symptoms. Then again, I will highly recommend to check your blood pressure at that time, making sure that your blood pressure is not elevated. Nausea and vomiting, that's another feeling people can have with the elevated blood pressure. Visual changes, blurry vision, spots, loss of vision, they all can be present with your elevated blood pressure. Unresponsiveness. People can have altered mental status. That is another sign which should be monitored very carefully, and blood pressure should be checked. Nosebleeds, fits or seizures, severe chest pain or shortness of breath. So please do not take these signs lightly. These are serious signs and symptoms for having hypertensive crisis. Always and always check your blood pressure in these situations and seek help immediately, because these symptoms with elevated high blood pressure can be fatal. So after discussing what symptoms can be there, I thought that we should show a bar diagram to see which symptoms are more commonly present amongst the population. So if we see on this diagram to the far right, headache is the most common. Up to 40% of the people will have headache associated with hypertension during hypertensive crisis. Nausea and vomiting is around 20%. Weakness in your body, right or left, upper arm, lower arm, that people are not able to use the limbs and loss of strength, that is a sign of stroke. Then is chest pain, then is loss of consciousness and shortness of breath. So these 6 symptoms are quite prevalent, and their prevalence ranges between 40% to 6%. So I will again say that, you all know that hypertension is a silent killer. But when it goes up to that height, when the numbers reach 180 to 120 millimeter of mercury, still people may not have signs. But yes, some of people may have symptoms, and both conditions are equally, I would say, serious. But again, someone is having symptoms, maybe it's a blessing in disguise that those people will seek attention, medical attention more quickly, as compared to those who do not have symptoms. So if you ever find your blood pressure in the range above 180 to 120 millimeter, please always recheck your blood pressure within 5 minutes. Try to relax yourself, try to empty your bladder, sit down and recheck it. But again, don't wait to recheck it if you are having blood pressure above 180 or 120 and you're having any of the symptoms we have discussed. And if after 5 minutes, if you do not have symptoms, you check your blood pressure and blood pressure goes down, immediately call your healthcare provider, because you still need to be seen or need medical care so that the blood pressure can be lower. If you forgot to take the medicine that day, please take your medications immediately. And if reading persistently remains high, you need to make sure you reach out to your healthcare provider if you're not having symptoms, so that you can be seen immediately or go to a walk-in center. If you're having symptoms, call 911 and go to the nearest emergency room. Again, do not wait at home with these symptoms or these numbers of blood, higher number of blood pressure readings. Call 911, go to the nearest emergency room, because these high blood pressure readings with symptoms or without symptoms can be fatal. People can lose life with these higher blood pressure readings. So how do we treat these? And that's what I was trying to explain earlier, that this is not something which we can treat as an outpatient, even in doctor's offices some of the time. But, like some of our offices are equipped with intravenous medications we can provide, but some offices have no access to intravenous medications. And that's why it's important to go to a place who can administer these medications intravenously. And mostly hospitals or the walk-in centers or the urgent care centers are the one who can provide you this care. Then again, when you have these situations, you require intravenous medications, blood pressure lowering medications intravenously. Oral medications may not help at that time. And then we reduce blood pressure by no more than 25% in the first hour. Because if we reduce the blood pressure rapidly, more than 25% in first hour, then that can cause reduce perfusion to brain and other organs, and that can lead to, again, organ failure. Once the blood pressure has been stabilized, symptoms have resolved, then we can switch patients to the oral medications, and then maybe we'll have to titrate the dose or change the medication so that the patient does not go through again from this crisis. So what are the medications? Medications, usually what we use during these crisis moments, we need to pay attention to a few things. Patient, is a female patient, make sure patient is not pregnant. So make sure when you have this kind of situation, you go to the doctor's office, make sure the doctor knows about your whole health and if you're pregnant or not. Let the doctor know about all health-related comorbid conditions, diabetes, or any other past medical history what you have. And if you have used illegal drugs and that led to the hypertensive crisis, please be open to your care provider, because then again, that's going to help the doctor to choose the right medicine for you to lower your blood pressure. So those are the very important things to share with your healthcare provider. So these are the timeline for blood pressure goals for the hypertensive crisis. So if someone has blood pressure 220 or 120, then it needs to be lowered within 1 hour to less than 185 to 10, then within 24 hours, less than 160 to 110, within hours after that, 140 or less, and then eventually within 24 hours, we need to lower it less than 120. So this is how you will be treated in the emergency room. So I put it there so that you know that you should not be expecting your blood pressure to be normal within an hour or 2 hours after you have experienced an hypertensive crisis episode. How to prevent these episodes? And this is extremely important because it's not fun to go through the hypertensive crisis because it can cause severe permanent damage. So first and foremost thing is, please take your medications on a regular basis as prescribed. If it has been prescribed twice a day, take it twice a day. If it has been prescribed for 25 milligrams, please make sure you take 25 milligrams. Because a study found in 2015 that people who often did not take their blood pressure medications were more likely to be hospitalized and develop worsening of the health issues than those who took their medications regularly. Then again, lifestyle changes. Make sure you eat right. Make sure you do not eat food which is in high concentration of sodium or salt, processed food, foods with preservatives, mostly processed meats or animal-based foods. Those are all can cause hypertensive crisis. Some of the foods available at restaurants may also give you hypertensive crisis. There are certain preservatives or the condominiums in different foods can also induce these hypertensive crisis. So if you have high blood pressure, so make sure you go to a place where you usually go to and you are familiar with their cooking habits. Eating a healthful diet, as I mentioned earlier, there's a diet which is called DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. So that's a diet which is proven effective for controlling blood pressure. And then making sure you read the labels for sodium and salt. And another diet which has been proven effective for cardiovascular preventive measures is Mediterranean diet. And that diet is rich in fruits, vegetables, high fiber diet, legumes, beans, nuts, and olive oil. And this is also low in fat and low in salt. So make sure if you have a history of hypertension, you follow the Mediterranean diet, you follow the DASH diet, you read the labels, and be careful when you're consuming any food which is not known to you or you're not familiar with that food before, because that might have some ingredients which can lead to hypertensive crisis in your case. Cutting down the caffeine and alcohol. So caffeinated products are also associated with high blood pressure. If we have to have coffee, it should be in a limited amount and maybe decaffeinated. Then limiting the alcohol intake. The 2020-25 dietary guidelines recommend adults to avoid or limit their alcohol intake. Men should not consume more than 2 drinks per day, while women should consume no more than 1 drink per day. So these are the dietary guidelines. If we go above and beyond that, then that can lead to worsening of the hypertension and hypertensive crisis. Another thing which hurts at times is the portion size, because excessive amount of food will have excessive amount of sodium and excessive amount of salt and other ingredients, which may lead to elevated blood pressures. Use salad plates and get rid of the dinner plates, because it's a portion. Salad plates, you will be able to put less amount of food. And in some of the papers I have read that they say, don't take one time what you cannot put it in your palm. And if you have any doubt about your diet, that which diet should be healthier for you, always please check with your dietitian or your primary care provider which food is right for you. And also you should know that if you are taking any medication which has a special interaction with any food ingredients or any food or nutrition content in the food. So always be very careful and be in touch with your healthcare provider. Last but not the least is getting regular exercise. 35 minutes of exercise every day, because regular exercise keep your health and circulatory system healthy. It helps you to lose weight and it helps to maintain your blood pressure. CDC recommends that we should aim for 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity every week. However, these figures may vary from person to person depending on the other comorbid conditions. So always discuss this with your physician or your primary care provider so that you can be guided about your limitations to the exercise with cardiovascular disease before you start an exercise program. Avoiding smoking and drugs. As I mentioned earlier, those who smoke, their blood pressure can rise within 10 minutes of start smoking. And if you have a habit of smoking, please talk to your doctor and find out the ways how to quit, find out the resources, because this habit can be treated easily. We have the medications available to prevent the side effects from all these bad habits. Always try to stay away from the illicit drugs, because those are one of the major reasons, especially in younger population, for the hypertensive crisis. This is something which at a younger age we do not pay much attention, that getting enough sleep is very important for a healthy body. Having a good night's sleep is good for your health and circulatory system, because when a person sleeps, the blood pressure drops. Adults should have at least 7 hours of sleep. And also, we need to look into it. What is, sleep hygiene? What are the good habits of sleeping? During the daytime when you're awake, try to get plenty of physical activity, exercise, which will be helpful, and that also lead to a good night's sleep. Waking up and going to sleep almost every day at the same time also gives you a habit of, good sleep at night, having a consistent bedtime routine and sleeping environment, like sleeping in a cool, dark, comfortable, and a place which is less noisy and have other less distractions. Putting the cell phones away before you go to bed is another good habit which we need to follow, because now we are attached to these cell phones so badly that we need to learn how to detach yourself before going to bed. So in summary, what we can say that hypertensive crisis occurs when blood pressure raises above 180 or 120 millimeter of mercury. A person experiencing hypertensive crisis may or may not have any symptoms. However, without treatment, the condition can damage blood vessels and major organs. Factors that can give rise to hypertensive crisis include not taking blood pressure medications, interaction between certain medications, the use of illegal drugs. Certain underlying health conditions can also trigger hypertensive crisis. So there are some steps a person can take to lower the blood pressure and reduce the risk of experiencing hypertensive crisis. These steps include healthy diet, reduced alcohol intake, quitting smoking, and living a healthy lifestyle. Anyone who would like further advice about lowering their blood pressure, please, you can talk to your primary care provider, talk to your doctor. Towns like Windsor have nursing help available, like Jenny's here. She's open to answer your questions. So always reach out to someone if you have any questions about this. But please remember, it is extremely important to work on to treat this silent killer, which is extremely prevalent in our society. Thank you very much. And I'll be available if you have any questions, and I'll be happy to answer your questions. And thank you very much for your time. So it seems we do not have any audience today here or in our virtual contact. So we will end this today, and Jenny will be here to demonstrate to check the blood pressure. You all have a good night, and thank you very much for being a good listener.
Thank you very much, Dr. Mirza. As we've concluded each of our workshops, we've done a demonstration of the self-monitoring device. We also have a workshop that Paula Rains did probably in April, and that is available on the website, and you can watch a taped version. As a reminder, when you get up in the morning, you should do a few activities before you sit down to take that first blood pressure. You want to make sure that you've emptied your bladder. You might start a load of laundry. And you should avoid all exercise and caffeinated beverages before taking your blood pressure. So you will want to connect the cuff, the end of the cuff, into the machine. You want to sit in a chair with your feet flat on the floor, your back supported by the back of the chair, and then place the cuff on your arm, and you want that to be bare, not over any kind of night clothes or clothing. And the tubing should come out the bottom of the cuff. And you're trying to align that tubing with the center of your elbow. So this might take a little time just to master, because you are trying to do this one-handed. So that worked to kind of use my arm to hold it in place while I pull snugly. And then you want to rest your arm on a table so that your arm and your heart are about the same level. Then you just simply press the start button, and there should be no talking while you're taking your blood pressure. So if there are others around, make sure that they know that you need to be silent. You would press that button and then wait for the cuff to inflate. Once it stops, you'll want to record the information or the reading on your monitoring device or paperwork so that you have that information that you could bring into the doctor's office. You could also bring in your monitoring device to the practice so that you can compare the reading that they're getting to the reading that your machine is getting to make sure that they are somewhat consistent. All right. Again, reminder, if you need a home monitoring device, please let me know. And again, please complete the pre-diabetes risk assessment form as well as the evaluation for each of the presentations. Thank you and good night. So nobody.